Conducting a head-to-toe assessment. Standard steps.
Hi, my name is Nurse Williams. I'm here today to do your head-to-toe assessment. Can you tell me your name?
Jennifer.
Hi, Jennifer. It's nice to meet you. May I see your ID band, please? Jennifer Rivers. Can you tell me your date of birth?
3/17/57.
Okay. Can you tell me who the president is?
Is that Obama guy?
Yes, it's the Obama guy. The client is alert and oriented ×3.
Assessment data collected in the general survey during the history. Level of consciousness and mental status, general skin color, overall posture, position, mobility, ability to hear and speak.
The client's skin complexion you will assess by inspecting the client according to her ethnicity. You will also look for any abnormalities. You're going to look for any lesions, any scars, any bruising. You're going to also begin to palpate. When you palpate after inspecting first, you're going to ask the client, do you feel any pain? Does this hurt? You're going to palpate around the sinus area. You're going to look at the client's scalp. When you're looking at the scalp, you're going to look for any dry skin, any dandruff, any bruising, any nodules, and then you're going to palpate as well. Do you have any pain?
Assess vital signs and other baseline measurements.
At this time, you will go ahead and do your vital signs. You're going to also make sure to assess the client's mobility while in bed. So you're going to check to see if the client can move in bed. You will ask the client, can you move your arm? Okay, can you move your legs? Wiggle your toes? This client is moving perfectly well.
Palpate temporal pulses for amplitude. Inspect for facial features and symmetry. Ask client to clench teeth.
Okay, at this time you're going to assess. You want to make sure to elevate your bed to working height. So at this time I'm assessing the client's facial features for symmetry. I'm going to assess the client's temporal pulses for amplitude. You palpate at the same time. And when you assess and document this, you're going to document according to 0+ being absent, 1+ is pretty weak, 2 is normal, 3 is a full pulse, and 4+ will be bounding. You will also have the client, can you open your mouth for me? Can you close? Does that hurt? Okay, you're assessing for the client's TMJ, temporomandibular joint, and you're going to palpate and you're going to assess for any abnormalities.
Inspect bony structures of face for size, symmetry, and intactness.
And the client's facial structures are intact and they are aligned.
Inspect skin for color and lesions. Palpate skin and scalp surfaces for texture, tenderness, and lesions.
And they're all intact. They were already assessed and the client is okay.
Palpate facial bones for size, intactness, and tenderness. Examine eyes, perla.
At this time, you're going to assess the client eyes, and when assessing perla, you're going to assess for the size of the pupil, assess to see if they're equal, round, if they react to light and accommodation. Mrs. Rivers, I would like for you, if you will, please look straight ahead at that wall. So when you assess, you're going to start from the outer to the inner. I'm looking at this client's pupil. They're equal, they're round, they're 3 mm, they react to light, they constrict and dilate accordingly.
Inspect conjunctiva and sclera for color and clarity. Inspect cornea for transparency.
You're going to assess simultaneously. You're going to make sure to press down. You're going to look at the conjunctiva. You're going to look at the color. They should be a darker red. They should be a dark pink to red in color. You want to make sure there's no excessive drainage, no itching, no pulse coming from the eyes, crusting. You're going to also make sure that everything within the eyes is clear, transparent. You're going to look at the eyelids and make sure that there's no nodule, bruises, or lesions there as well.
Inspect symmetry of eye movements.
At this time, you're going to look at the symmetry of the eye movement in the 6 fields. So, Ms. Rivers, I want you to follow this pen with your eyes, not moving your head. Okay? And the client followed as commanded and is intact.
Assess papillary response, consensual reaction, corneal light reflex, and accommodation.
We assessed all of that when we did the perla, and it's intact.
Inspect iris for shape and color.
And when we assess the pupils, you want to also look at the iris, and you want to make sure to take note of the color of the iris and the shape. And as we stated, her iris and the shape is round. Eyes is light brown.
Examine ears.
At this time, we're going to examine the ears. When you go to examine the ears, the first thing you're going to do is inspect. And when you inspect, you're going to look at both, on both sides, and you're going to compare. You're going to assess to see the symmetry according to the eyelid moving back. You're going to look at the auricle. Once you've finished your assessment, which is your inspection looking, you want to, at that time, begin to palpate. Do you have any pain? Is this sensitive? Does this hurt? And the client stated no. You're going to make sure there's no lesions, no nodules, no excessive drainage. Then you're going to go ahead and look into the internal ear. So at this time, you're going to look. And what you're assessing for, you're going to assess to see if you see any cerumen, which is earwax. And you're going to look on both sides. Can you turn your head for me? Up and back. At this time, you will also assess the tympanic membrane, and you're going to assess which is the eardrum, and it should be a dusky to a pearly gray, and you're going to assess on both sides.
Weber's test and Reinl test.
At this time, we're going to do the Weber's test. With the Weber's test, you're going to instruct the client. Ms. Rivers, I will put this tuning fork on the top of your head. You're going to feel a vibration. When you no longer feel the vibration, I want you to hold your hand up for me, okay? Okay. Mrs. Rivers should have been able to feel this vibration equally on both sides. The next test that I will be doing is called the Rhine test. With the Rhine test, I will take the tuning fork and I will hit it, and I'm going to have Ms. Rivers to put her finger up when she can no longer feel it. You will place the end of the tuning fork on the mastoid bone. After she can no longer feel it, I will place the tuning fork in front of her ear, and once she can no longer hear the vibration, she will put her hand up again.
Examine nose, mouth, and oropharynx.
At this time, I'm going to begin by looking at the external. So I'm going to look at the nose for symmetry, alignment, make sure that there's no deviated septum. I'm also looking to make sure that there's no swelling, no scars, no bruising. And at this time, I'm looking at the external nose and the lips. I'm assessing the lips to make sure that they're pink and moist, no dryness, no scars, no lesions. After I look at the external, that's when we begin to look inside internally. So at this time, I'm gonna begin by looking, this time put your gloves on. Okay, so I'm looking in the nares. So I'm looking to make sure it's not swollen, no sores. And can you sniff for me? Okay, I'm just making sure that it's patent. At this time, I'm gonna have Mrs. Rivers to open up her mouth. I'm looking in the oral cavity, and I'm looking at the hard palate. I'm looking at the soft palate. I'm looking inside of the alignment of the mucous membrane, okay? And what I'm assessing is making sure there's no sores, no lesions, no nodules. I'm gonna also look at her tongue. I wanna make sure that it's straight and aligned. Can you say out for me once again and stick out your tongue? Okay, so what I'm looking on both sides. Okay, thank you. And I'm also looking at her teeth. You're gonna take note if she has any type of fillings, cavities. You also wanna make sure that there's no sores. And you're gonna also assess up underneath. And you're looking at the salivary glands, and the last thing you're gonna do is take the tongue blade and you're gonna assess the gag reflex. Can you say out for me? Okay, very good. And the gag reflex is intact. Then you would discard of your gloves. And the next, you will check the TMJ. I believe we checked that already. So next, the temporal mandibular joint. And what I will have Ms. Rivers to do, can you open once again, say ah, and close. You're gonna put your fingers here to see if you have any crepitus, any cracking, any misalignment. And you're gonna also ask her, does it hurt when you open and close? Okay, and you're gonna palpate accordingly.
Examine neck. Inspect neck for range of motion. Test range of motion of head and neck. Shrug shoulders against resistance.
Okay, can you turn your head to the side towards my hand, to the opposite side? Can you lift up to the sky, down? Can you shrug your shoulders up? Okay, down. Very good.
Palpate carotid pulses one at a time for amplitude. If indicated, auscultate carotid for brutes. Assess thyroid glands and lymph nodes of neck.
You turn your head to the side for me. To the opposite side. You want to make sure to note if there's any hard nodules. You want to make sure if you feel any lumps to take note and make sure to feel around for the size and document it accordingly.
Examine upper extremities. Inspect client's arms for skin characteristics, symmetry, and deformities.
Okay, I'm just going to pull this down a little bit. So we're going to assess simultaneous to make sure that the arms are symmetrical. You're going to look and inspect for any lesions, scars, bruising, and you want to make sure to take note of it. At this time, you can also assess the client's strength by having them squeeze your finger. Okay, and it's equal strength in both extremities.
Palpate arms, elbows, and wrists for temperature, tenderness, and deformities.
You're assessing the lymph node.
Palpate brachial or radial pulse for presence and amplitude. Palpate epitorchlear lymph nodes for size and tenderness. Test range of motion, muscle strength and sensation. Test elbow deep tendon reflexes.
And have the client move her hands up, down, in a circular motion. And then you're gonna also, we already did the muscle strength, and we're gonna assess for the client's deep tendon reflex in the elbow. Okay. Thank you.
Examine hands. Test capillary refill. Assess lanula, cuticle, and nail plate. Assess for clubbing, Bowes lines, splinter nail, coronacea or paranacea.
Can you hold your index fingers together like that? You're gonna assess for clubbing. Thank you.
Assess posterior chest.
At this time, we're gonna assess the posterior chest. Mrs. Rivers, I'm going to position your bed so you can sit alongside, and I'm going to assess your posterior chest.
Observe posterior and lateral chest for symmetry of shoulders, muscular development, scapular placement, spine alignment, and posture.
At this time, you're going to make sure to assist your client, and you're going to assess their posterior chest. So you're just looking to make sure that it's aligned. You're looking for symmetry. You're going to also inspect. So you're looking at any type of discoloration, lesion scars, and anything that could be abnormal.
Observe respiratory movement for symmetry, depth, and rhythm of respirations.
Can you take a deep breath in and out for me? Okay, now just breathe normally. And you're going to assess to make sure there's no abnormal deep respiration, labored breathing.
Palpate posterior chest and thoracic muscles for tenderness, bulges, and symmetry. Palpate posterior chest wall for thoracic expansion. Palpate posterior chest wall for fremitus. Palpate vertebral column for alignment and tenderness.
When you're assessing for alignment, you're just going to go right down the spinal cord area. And when you palpate for fremitus, can you say 1, 2, 3 for me?
1, 2, 3. 1, 2, 3. 1, 2, 3.
Auscultate posterior and lateral chest walls for breath sounds. If adventitious sounds heard, assess for bronchophony, egophony, and whispered pectoraliqui.
Deep breath in and out. When auscultating the lungs and the posterior, you want to make sure to assess and check in 10 locations. If there are any adventitious sounds, that's when you will go in and do your check for egophony, bronchophy. At this time, you will put on the stethoscope again, and you're just gonna have the client to say, can you say